Clean up after yourself. How many times did your mother tell you that when you were growing up? A mother knows best, and whether your mother was a nurse or not, she did understand that keeping things clean meant keeping bugs away, be it ants or microscopic ones. While a mother is unlikely to engage in the same cleaning techniques used in hospitals, she is trying to maintain some state of asepsis in her home when she tells you to clean up. Asepsis is a word that in general describes freedom from living pathogenic organisms. By pathogenic, I mean organisms that can cause disease. And while I emphasize pathogenic or bad organisms, note that the techniques used in maintaining asepsis don't discriminate. They kill or avoid the good guys as well as the bad. Let's go over the concept of medical asepsis. And then test your knowledge of it with a case example. Medical asepsis refers to any number of practices that are designed to prevent the spread of infection. This is sometimes also called the clean technique. What can you do as a nurse to help prevent the spread of infection? One thing you can do, one thing any mother would advise you to do as well, is to just wash your hands. You do remember your mother telling you that, don't you? And so, hand hygiene is one standard precaution used in medical asepsis. This means you need to wash your hands thoroughly for at least 20 seconds with soap and water. If you wash them for any less than that, you're just spreading the microorganisms around your hands. An alternative to hand washing is to use antibacterial hand gel, but this comes with two catches. The first catch is that this type of gel is pretty much useless if your hands are visibly dirty. Another important catch is that you should avoid its use if the patient has an illness caused by spore-forming microorganisms, as these hand gels aren't effective at removing spores. Another thing your mother would tell you would be to clean the things around you, the environment. So cleaning up spills, dirty surfaces, and using disinfectant would be examples of this. Medical asepsis also includes the use of PPE, personal protective equipment, the likes of gowns, gloves, and even masks, eye and face shields. Gloves should be used when touching any bodily fluids and secretions or items and bodily tissues contaminated with them. This means you need to wear gloves when touching a patient's mucous membranes, as they contain bodily secretions. You also need to wear gloves when taking blood and so on. Gowns should be worn if you're going to be involved in a procedure where your skin or clothing may come into contact with any bodily fluids. The obvious example here is wearing a surgical gown during an operation. The same goes for masks, eye protection, and face shields. These should be worn when any bodily fluids may splash on you or be spread in the air around you, such as during endotracheal intubation, a procedure where a person has a breathing tube inserted into their trachea, or when dealing with a patient who has a highly communicable respiratory disease. When it comes to needles, you should never recap a used needle, break or bend a needle. And you should always put all sharp objects like blades and needles, into a purpose-built sharps container. What I mean by purpose-built is that these are containers that are red or yellow in color, depending on what country you live in, and are specifically designed for sharps disposal. Finally, help prevent the spread of disease by covering your mouth and nose when you sneeze or cough, and following hand hygiene techniques immediately after you do so. Okay, now you've got the basics of medical asepsis down. Why don't I test your knowledge a bit with a real-world example? Just listen carefully, and then tell me what you think went right and what went wrong here in terms of medical asepsis on the nurse's part. A nurse enters a patient's room in order to clean the patient's genital area. She puts on some clean gloves, cleans the genital area, and then takes off her gloves and moves on to her next task. This was a very simplistic example, but can you tell me what the nurse did right and what she did wrong? Let's examine what she did right in terms of medical asepsis. Two main things. She used clean gloves to help protect herself and the patient from contaminating one another. Check. She also helped prevent a possible infection from developing on or in the patient by cleaning the genital area. Check. What did she do wrong? She forgot to clean her hands after taking off her gloves. And did you spot the other problem? She forgot to clean her hands before putting on her gloves, something most people don't think about. The use of gloves is not a substitute for proper hand hygiene. This is why if a nurse uses any PPE, the nurse should wash her hands prior to and after their use. Asepsis describes freedom from living pathogenic organisms, and specifically medical asepsis refers to any number of practices that are designed to prevent the spread of infection. The core parts of medical asepsis include hand hygiene, cleaning the environment, the use of PPE or personal protective equipment, and proper disposal of sharps.
When you begin to think about it, clean is a very relative term. There are all sorts of clean. My house is tidy, so I wouldn't be embarrassed if guests dropped by is different from, my floors are so clean you can eat off of them. Well, the same is true in the medical world. There are several types of clean. In this lesson, we are going to describe the cleanest possible clean, or surgical asepsis. Surgical asepsis is ensuring an environment is completely free from all microorganisms. Why would this be important? Because these microorganisms, if present in the environment, could lead to an infection in the patient. Surgical asepsis is practiced in many fields of medicine, but always with the same purpose of preventing infection. Usually, surgical asepsis is used when a foreign object is being introduced into a patient's body, thereby opening a possible route of transmission for an infectious agent. For example, a patient needs to have a urinary catheter. A catheter is inserted into the patient's bladder using surgical asepsis. Otherwise, the patient may develop a urinary tract infection. Other procedures such as wound dressing changes or certain IV therapies also require surgical asepsis because there is a direct opening between the outside world and the patient's bloodstream. Lastly, and most obviously, surgical asepsis is used in surgical procedures. However, this too can range from open heart surgery in an operating room to excision of a skin cancer in a dermatologist's office. In order for surgical asepsis to be achieved, all the components involved in the procedure, tools, work area, and workers, must be free of all microorganisms. First, equipment to be used in the procedure must be sterilized. This is accomplished by physical or chemical sterilization. Equipment is packaged with a date of sterilization. When it is time to open the package, the healthcare worker must inspect the package to make sure it is intact. Any evidence of moisture or a break in the seam means the instrument is considered unsterile. It is discarded and another is used. Next, a sterile field must be created, which is a work area that is free of all microorganisms. To create a sterile field, a sterile drape is placed over a tray, upon which sterile instruments may be dropped. Also, the patient is covered with a sterile drape to create an aseptic field in which the healthcare providers may work. Finally, the healthcare workers must wear sterile gowns, hats, gloves, and face masks. It is important to note that only the front side, from shoulder to table level of a sterile gown, is considered sterile. The sleeves of the gown are also sterile. Once all the components, equipment, environments, and persons are surgically aseptic, then the procedure can safely begin. Sterile technique is the means by which a surgically aseptic environment is set up, worked in, and maintained. The most important principle to remember regarding sterile technique is sterile items remain sterile only when touched by other sterile items. This may seem straightforward, but as we continue, you will see many opportunities in which surgical asepsis can be unwittingly broken by poor sterile technique. If any of the following occur, it is considered a breach in the surgical aseptic technique. The area is considered contaminated, and the whole process must be started from the beginning. The sterile field is exposed to air for too long. The sterile field is coughed or sneezed upon, or excessive talking occurs over the sterile field. A sterile object drops below the waistline of the healthcare worker. An unsterile object comes into contact with any part of a sterile object. A sterile object touches the edge of the surgical tray. Only the tray top is considered sterile. A healthcare worker leans over the surgical field. The caregiver working within a sterile field and with sterile equipment must constantly remember the principles of sterile technique if surgical asepsis is to be maintained. In order to decrease the risk of post-procedural infections in patients, an environment free from all microorganisms or a surgically aseptic area is created. All the components to be involved in the procedure, including the tools, workspace, and workers, must be sterile. This sterile field is created using sterile technique, which has a very specific set of rules regarding how the area is set up and worked in. When surgical asepsis is practiced properly, it helps ensure the safety of the patient.
Is just not good enough. Such is the case when performing invasive procedures on the body, those that involve penetrating or entering the body. In these instances, we need to utilize surgical asepsis and the very similar concept of sterile technique. Surgical asepsis refers to a method of utilizing sterile equipment and supplies, ones that have been treated in such a way that all living organisms once found on them have been killed. This means very hardy spores are killed as well. Sterile technique is a method that's used to prevent contamination during an invasive procedure. In this lesson, we'll go over some of the core concepts related to surgical asepsis and when the sterile technique should be used. In turning to surgical asepsis, you are going to be using equipment and supplies, such as gloves and surgical instruments, which have been sterilized. This means all the living organisms have been killed. There are different types of sterilization techniques, including autoclaving, which uses steam under pressure to kill all microorganisms, ionizing radiation, the use of chemicals to sterilize some kinds of medical equipment, and the use of ethylene oxide gas to kill all pathogens. When using sterile technique, you need to keep three very basic but extremely important things in mind no matter what. Sterile plus sterile equals sterile. Sterile plus unsterile equals contaminated. And obviously, unsterile plus unsterile equals contaminated. By contaminated, I mean the potential for the presence of pathogenic or disease-causing organisms is there. This means that if a sterile object touches another sterile object, both remain sterile. If the sterile item touches something unsterile, like your skin, blood, or a piece of unsterile equipment, even if it looks clean, then the previously sterile object is no longer sterile. Note how I said your skin. Remember, skin is never sterile. I could care less how often you washed it and for how long. Human tissues are never considered to be sterile. So, if any unprotected part of your body touches a sterile piece of equipment, the equipment is considered to be contaminated. Now that you know this, I need you to understand another extremely critical component of surgical asepsis. That is the concept of surgical or sterile conscience, being acutely aware of potential or actual contamination of a sterile field or object, and taking the necessary steps to remedy the situation. The terms surgical conscience and sterile conscience are pretty much the same, but surgical conscience is a bit broader in scope as it includes the legal, professional, and moral responsibility to patients and colleagues to properly use the principles of surgical technology and asepsis in order to make intelligent, knowledgeable, and sometimes courageous decisions, all in order to benefit the patient. Now, the obvious part of the sterile conscience is, for instance, replacing a contaminated instrument with a sterile one. The problem is that sometimes you may be the only person who knows that contamination has occurred. Maybe you even caused that contamination by accident. In these scenarios, it's of utmost importance that you be honest about the contamination. It's okay. Everyone makes mistakes. It's one thing to make an honest mistake. It's another thing to cover it up. The former is just that, an honest mistake. The latter can prove deadly to the patient. And secondly, always put the patient's safety above anything else, including your own embarrassment or convenience. That is to say, it may seem inconvenient to correct the error, but it actually is never so. You must be responsible about caring for your patient, and in a surgical setting this starts with the concept of a sterile conscience. It may mean even having to start the procedure over, but that's what may need to be done in order to ensure the safety of the patient. The big question should be, when do I use sterile technique? A physician may not tell you when, and it'll be up to you to decide. You should use the sterile technique in the following instances, some of which overlap. Any procedure that exposes a body cavity or enters a blood vessel. When a procedure calls for the use of a piece of equipment that enters a normally sterile body cavity. An example is inserting a catheter into a vein, injecting a medication into subcutaneous tissue, or putting a catheter into the bladder. Another instance is when using any sharp objects like needles and scalpel blades, or when caring for patients who have broken skin, be it due to a laceration or a burn or something else. Surgical asepsis is a method of utilizing sterile equipment and supplies, ones that have been treated in such a way that all living organisms once found on them have been killed, and the sterile technique is a method that's used to prevent contamination during an invasive procedure. I need you to take away several important points about these two topics. Sterile plus sterile equals sterile. Sterile plus unsterile equals contaminated. Unsterile plus unsterile equals contaminated. Skin is never sterile. Note your surgical or sterile conscience. Being acutely aware of potential or actual contamination of a sterile field or object, and taking the necessary steps to remedy the situation. And use the sterile technique in the following instances. Any procedure that exposes a body cavity or enters a blood vessel. When a procedure calls for the use of a piece of equipment that enters a normally sterile body cavity. When using any sharp objects like needles and scalpel blades. Or when caring for patients who have broken skin.
It's interesting to note that on the human body, the same basic concept occurs with respect to flora, the collection of microorganisms inhabiting a person. There are two types of flora, normal flora and transient flora. Let's distinguish between the two and showcase some examples of each. Normal or resident flora are microorganisms that are always present on or in a person and usually do not cause any disease. These are like the permanent residents of a city. They're not just passing through. Depending on what part of the body we're talking about, the normal flora can vary. For instance, on the skin, normal flora is made up of bacteria such as staphylococci. In the mouth, bacteria called streptococci can be found. Just like the normal residents of a city like to keep their city in order, resident flora typically do not cause problems to the person. However, just like some people take advantage of a city and its residents when it's weak by committing crimes, some resident flora are potential opportunistic pathogens. What that big term means is that these microorganisms lay low and cause no trouble when the person is healthy. However, as soon as they sense the person is sick with another serious problem, they strike to cause a disease of their own. While cities have permanent residents, they also have visitors. This is like transient flora, episodic microorganisms found on or in a person. Some of these guys cause no trouble, like tourists passing through a city, while others are most definitely trouble, like terrorists coming into a city to wreak havoc. Let me give you some concrete examples. Transient microorganisms like the yeast Candida can cause vaginitis, while norovirus is a contagious virus that can give you the stomach flu. It's not found in your gut on a normal basis, but if you eat or drink it in your food, you might feel pretty bad for a few days. While flora is indeed a word that refers to microorganisms found anywhere on or in your body, it is very commonly used to reference skin flora specifically. Why? Well, it's because it's important in a healthcare setting to know how the two are different in practice when it comes to washing your hands. When it comes to resident skin flora, gentle washing of the hands is usually not enough to remove them. You would need to wash your hands with soap, water, and scrub your hands and pick your nails to remove any significant amount of resident skin flora. You know, like residents of a city, they kind of don't want to leave without being forced to leave. On the other hand, transient skin flora more commonly attached to the skin for a brief period of time, and washing your hands with soap and water without even having to scrub is usually an effective way to remove them. Flora is a word for the collection of microorganisms inhabiting a person. Normal or resident flora are microorganisms that are always present on or in a person and usually do not cause any disease. For instance, a lot of staphylococci inhabit your skin. You'd have to scrub your hands with soap and water to have a good shot at removing these guys. Transient flora are episodic microorganisms found on or in a person. An example of this is the norovirus, which can cause the stomach flu. Actually is, hygiene is quite simply the science of health, and hand hygiene is one of the most important, if not the most important, aspect of controlling and preventing the transmission of infection. Since it's that important, let's go over some important points about hand hygiene, including how to properly wash your hands in a step-by-step manner. In a bit more detail with respect to what I just mentioned, why do we bother with proper hand hygiene? It's because the first line of defense we have against infection is the skin. By keeping the skin healthy and free from potentially pathogenic or disease-causing substances and organisms, we also serve to protect the rest of our body. If the skin is dirty, it might get infected, and that infection puts a strain on the body. Worst of all, that infection can spread throughout the body, especially if the person is suffering from an already debilitating condition. If the skin is full of pathogens and we touch our mouth or eyes, they can get infected too. This can cause problems such as the stomach flu. It doesn't matter if you're a nurse in a hospital or simply coming home from a day at work. Proper hand hygiene is always important for your safety or for that of your patients. And it's important you follow the steps I'm about to go over in full. This is because inadequate hand washing can actually just spread germs around without killing them or washing them off. So how do you wash your hands properly then? Let's go over the appropriate steps right now. Step 1. Turn on the faucet and simply wet your hands with some water. Step 2. Squeeze enough soap into the palm of one of your hands. Enough means it will be able to cover both of your hands in their entirety as you proceed with the following steps. Step 3. Rub your hands palm to palm. Step 4. Rub your right palm over the surface of the back of your left hand as you interlace your fingers. Do the same with your left hand over your right. Step 5. Rub your hands palm to palm again while interlacing your fingers at the same time. Step 6. Interlock your hands in the manner you see on the screen so that the palms of your hands can rub the back of the fingers of the opposite hand. Step 7. Grasp your left thumb with your right hand and rub it in a rotational manner as if you're revving the throttle on a motorcycle. Do the same with the other thumb using your left hand. Step 8. Use the fingers of one hand to rub the surface of the palm of the other hand and vice versa. Step 9. Rinse your hands with water. Dry them with a single-use towel and use the towel to turn off the water. All of this should take you about 40 to 60 seconds, far longer than most of us wash our hands after going to the public bathroom. No? That's a lot of steps, right? But think about this. That pales in comparison to the number of steps you'd have to take to treat an infectious process in your body that resulted from poor hand hygiene, or poor hand washing techniques in this case. Hygiene is the science of health, and by utilizing the steps we just went over, we can definitely keep ourselves and our patients as healthy as possible, since hand hygiene is the most important part of keeping the transmission of infectious organisms in check. Home, even water sources are sometimes scarce, but I certainly want to maintain some form of hand hygiene. So what do? I use hand sanitizers. A hand sanitizer is commonly an alcohol-based substance that reduces but does not eliminate all types of germs in some situations. Let's see how these should be properly used. The definition for hand sanitizer says that they can reduce the number of microbes, and quickly so, in some situations. I say some situations because if your hands are visibly soiled and caked in dirt, then believe me, the hand sanitizer will be almost useless. Why? Well, the organic debris on your hands, the dirt, serves as a shield or cover for microorganisms against the microbe-killing alcohol. This means that if you are like me, out trekking in the woods, you need to clean the visible dirt off of your hands before you use the alcohol-based rub, so that microorganisms on your skin don't have a place to hide as you're trying to kill them. This is also true if your hands are greasy with some sort of oily substance. Hand sanitizers will not work as well in such scenarios either. Another thing you need to consider is what kind of alcohol-based rub you are using. A hand sanitizer should contain at least 60% alcohol in order to be effective, so check the label before buying it. While using soap and water to wash your hands is the best way to reduce the number of microorganisms on your hands, sometimes we only have hand sanitizer at our disposal, like in my case. If that's all we've got, that's way better than nothing. But just plopping some of that hand sanitizer into your hand isn't good enough. You need to use it correctly for maximum effectiveness. So, without further delay, let's go over the proper steps involved in this. Step 1. Squeeze about a palmful of the product into your cupped hand. Step 2. Rub your hands palm to palm. Step 3. Use your right hand's palm and rub it over the back of your left hand as you interlace your fingers. Do the same thing with your left hand over the right one. Step 4. Rub your hands palm to palm as you interlace your fingers. Step 5. Use the palm of one hand to rub the back of the fingers of the other hand, as shown on the screen. Step 6. Grab your left hand's thumb with the right palm and rub it as if you're throttling a motorcycle back and forth. Do the same with your right hand's thumb using your left hand. Step 7. Use the fingers of one hand to rub the palm of the other hand and vice versa. Let your hands dry a little and you're done. Although that seems like a lot of steps, it's the best way to ensure that you kill as many microbes as possible using a hand sanitizer. A hand sanitizer is commonly an alcohol-based substance that reduces but does not eliminate all types of germs in some situations. Remember, a hand sanitizer should be at least 60% alcohol in order to be maximally effective. When using one, don't just plop a dab and rub your palms together. Instead, use a palmful and follow the steps we just went over. You're getting blood from a patient, or perhaps you're going to assist in a surgical procedure. There are actually different ways gloves can be put on and taken off, all depending on if they're sterile gloves or not. By sterile, I mean free from all living organisms. This lesson will teach you how to properly put on and take off non-sterile gloves so you can keep yourself and your patient safe. In practice, how can you tell if gloves are sterile or not? Well, besides the obvious, which is whether or not they're labeled sterile or not, you can tell by the type of packaging they are in. If you see that a bunch of gloves are found in the same container, not separated by anything, they are likely non-sterile. An example of this would be your regular box of gloves you can buy at the local Wall-A Drug corner pharmacy. It's just a bunch of gloves all in one container, not separated into individually wrapped pairs. On the other hand, if you see only one pair of gloves wrapped in individual airtight packaging, they are likely sterile gloves. So how do you put on non-sterile gloves properly? Step 1. Make sure you properly wash and dry your hands before putting on any gloves. Many people forget to do this or think it's not important. Step 2. Take one glove from the package. With one hand, let's say the right one, hold the wrist end of this glove open. Step 3. With the left hand, bunch the fingers together into a point so that it looks like you're about to make shadow puppets with it. Insert the fingers of the left hand into the open wrist end of the glove. Step 4. Use your right hand to pull the wrist end of the glove onto the left hand while easing the left hand into the glove and spreading the left hand's fingers out into the correct positions. Repeat the same procedure with the other hand. At this point, once the gloves have been worn, assume every outer surface of the glove is contaminated with something dangerous regardless of how clean it looks. That means the only way you can properly remove a pair of gloves is if no outside portion of any glove has touched any part of your exposed skin. Only the inside portion of the glove, the one normally touching the skin, is allowed to continue touching the skin during glove removal. The importance of this cannot be overstated because the last thing you want is to touch your skin with the outside of a glove covered in a dangerous microbe. This means you have to follow these directions religiously because I don't want you getting sick. Step 1. Use your right hand's fingers to grab the wrist end of the left glove. Make sure you are touching only the outside of the left glove. Step 2. Pull the left glove towards the left hand's fingers. This should turn the glove inside out, exposing the cleaner inner surface of the left glove and the left hand's skin. Step 3. Do not let go of the left glove just yet. Carefully insert your left hand's fingers, or just one finger, into the space between the wrist end of the right glove and the skin of the right hand. Step 4. Turn the right glove inside out. leaving the left glove inside of it. Dispose of both gloves. By following these steps, you will have avoided touching any outer surface of the glove and will have kept yourself safe. While this lesson wasn't about applying and removing sterile gloves, gloves that are free from all living organisms, it did cover important procedures that will keep you safe nonetheless. Remember that the only way you have properly removed a pair of gloves is if no outside portion of any glove has touched any part of your skin. Only the inside portion of the glove, the one normally touching the skin, is allowed to continue touching the skin during glove removal. By following the steps we just went over, you'll be a pro at applying and removing non-sterile gloves.
Something really quickly, you would certainly choose the pressure cooker. That's because a pressure cooker seals your food and water in an airtight container. A source of heat, such as gas or electricity, is applied to the pressure cooker to heat it up. Because neither air nor liquid can escape the pressure cooker, it heats up very quickly and therefore allows the food to be cooked much more quickly as well. This same exact process is used in something known as an autoclave, which is a device that uses moist heat, that is to say steam, under pressure to kill off all living microorganisms on any object or surface contained within it. The reason an autoclave uses steam is because steam is essentially the gaseous form of water. Water is able to transfer heat far more rapidly than dry air alone. I'm sure you know this if you've watched some survival show that mentioned the fact that people lose body heat far more rapidly in cold water than cold dry air. Well, now you know why. Anyways, the steam in an autoclave is placed under a lot of pressure. This is done because anything under pressure, be it steam or dry air, increases in temperature very quickly. The very high temperature in an autoclave quickly kills off any living organism in it, including bacteria, fungi, viruses, and even hardy bacterial endospores. That's because extremely high heat will denature or destroy the proteins that make up the structure of a pathogen. The reason an autoclave is so important is because it gets the pesky endospores, which are very tough, long-lasting, dormant forms of bacteria that I mentioned before. These spores are formed when conditions favorable to the bacteria's survival, such as proper temperature and nutrition, become unfavorable. You can liken these bacteria to hedgehogs. If everything is fine, the hedgehogs will walk around just minding their own business. If they feel threatened, they curl up into a protective ball. That's what these bacteria do. They curl up into a protective ball when they feel threatened. These endospores are so tough that they can resist common household disinfectants. What's worse is they can survive being boiled for a very long time. So, one way to ensure they are killed on something as important as surgical instruments, which will enter your body during an operation, is to put those instruments in an autoclave. That's because the extremely high heat and pressure generated by the autoclave will be enough to kill even these hardy forms of bacteria. If they are not killed with proper sterilization, and they do enter your body by way of a contaminated surgical instrument during an operation, you may end up dying from a nosocomial infection, which is an infection acquired in the hospital. As a way to ensure that an autoclave reached the critical temperature high enough to kill these endospores and other microorganisms, test strip indicators are placed within it during an autoclaving procedure. If they change color, they indicate that the autoclave reached a temperature high enough to kill all life forms inside it. You can liken this color-changing test strip to those cool, heat-sensitive pencils. If you hold one for long enough, it will change color due to the heat coming off of your hand. These test strips use the same exact principle. While an autoclave is an awesome way to get rid of all living microorganisms on an important object, such as a surgical instrument, it's not without its faults. For example, if an instrument isn't cleaned well enough prior to being placed in an autoclave, the autoclave may fail. Imagine if there was a piece of tissue left attached to the surgical instrument prior to placement in the autoclave. This would be akin to giving our hedgehog a little house under which it can hide to escape the heat and pressure that is trying to kill it. Likewise, microorganisms can use this macroscopic dirt and debris as a shelter to survive being autoclaved. In addition, you can logically understand that steam under pressure isn't a great way to sterilize any type of material. Heat, steam, and pressure will do very little to high-quality German steel surgical instruments. However, if you were to put a paper object into an autoclave, it would be destroyed. Imagine taking a piece of paper into the shower with you. All of that steam would cause it to wrinkle. Other objects, such as plastic, may melt under the intense heat produced by the autoclave. Therefore, other sterilization techniques, such as gas sterilization by way of ethylene oxide, can be used for moisture-sensitive equipment, or cold liquid sterilants can be used for heat-sensitive equipment. Regardless of which method of sterilization is used, all living organisms, including endospores, which are very tough, long-lasting, dormant forms of bacteria, should be killed during the process of sterilization. One way to kill these endospores is by using something known as an autoclave, which is a device that uses moist heat, that is to say steam under pressure, to kill off all living microorganisms on any object or surface contained within it. If an autoclave or some other form of sterilization isn't used in the hospital, then you may acquire a nosocomial infection, which is an infection acquired in the hospital. Sometimes these nosocomial infections can be deadly. To all of life's problems. That man was none other than Homer Simpson, of course. I can sit here and make an entire lesson out of quotes and jokes about alcohol. However, in this lesson, I'll try to focus in on the effects alcohol has on microbes. Never mind the effects it has on you, such as headaches, loss of consciousness, severe liver damage, and premature death. Those aren't all that important. The first important thing we need to talk about is the different types of alcohol available for use. Now, don't get excited. This doesn't mean we'll be going on a trip to the liquor store anytime soon. We'll be talking about the types of alcohol that are used as a disinfectant or antiseptic. Those aren't the same thing, by the way. Disinfection implies the death of most microbes on an inanimate object, while antisepsis implies the death of most microbes on living tissue, such as your skin. The difference is slight, but still important. You can liken disinfection to a bacterium passing out on a floor, which is an inanimate object, while antisepsis implies that a bacterium passes out on a living friend after having too much from the tap after work. Anyways, these bacteria and other microbes can drink several different types of alcohol, including ethyl alcohol, a type of alcohol commonly known as ethanol or grain alcohol, isopropyl alcohol, an alcohol that is sometimes referred to as rubbing alcohol, and methyl alcohol, an alcohol that is also called methanol or wood alcohol. Methyl alcohol is very rarely used compared to rubbing alcohol or ethanol in medicine because it's quite weak compared to the latter two when it comes down to disinfection and antisepsis. It's like a light beer compared to whiskey or vodka. Hence, we will just focus in on rubbing alcohol and ethanol as we move on in this lesson. The way by which these two alcohols destroy bacteria, viruses, and fungi is through something known as protein denaturation. In basic terms, it's a process whereupon a protein loses its higher order structure. You can imagine that a protein is like a piece of metal. That piece of metal can be formed into many different things. For example, it can be made into a paperclip. The shape of the paperclip is like that metal's higher order structure. If you were to physically unwrap and uncoil that paperclip into a straight piece of metal, you would have metaphorically denatured it. When you uncoil that paperclip, it is still a piece of metal, but it has lost its function. It can no longer hold paper together. Likewise, when a protein is denatured by an alcohol, it is still a protein, but it cannot perform the function it once could. Well, if the bacteria, viruses, and fungi cannot rely on their proteins to do their job, they simply die. Another way by which alcohol can kill is by damaging the outer membrane of bacteria. It's like damaging your skin. If you lost all of your skin, you would die, since you would be unable to protect yourself from the dangers of the environment around you. Likewise, if you damage or dissolve the cell membrane of bacteria, they cannot protect themselves either and end up dying in the process. The good thing is that alcohol can kill many viruses, such as the influenza virus, which causes the flu, or the rhinovirus, which is responsible for the common cold. It can also kill plenty of dangerous bacteria, such as E. coli, and fungi, such as Cryptococcus neoformans. However, alcohol cannot destroy bacterial spores, which are very hardy forms of bacteria. Therefore, because alcohol cannot kill every microorganism on a surface, it is not considered to be a sterilant. Meaning, we shouldn't be using alcohol on something like surgical instruments, because a fatal infection during surgery may occur if a bacterial spore lodges into your body due to a dirty instrument. Leaving that tidbit aside, we can focus in on one last important part of this lesson. I'm almost certain you know that people who aren't nephilists, meaning people who don't drink alcohol at all, have a preference for a type of spirit, wine, or beer. Some like their drink really strong, while others prefer theirs light and smooth. If we were to choose a preference for the type of alcohol we'd want to use to kill our microbes, we would definitely go with the strong stuff. That's because alcohol at a concentration of between 60 and 90% is most effective in its antimicrobial activity. Anything less than 50%, such as your typical alcoholic drink, is just too dilute to do the job well. And if the alcohol is over 90%, it cannot enter the cell well enough to denature proteins inside of the microbe. So, recall that the three main types of alcohol are known as ethyl alcohol, a type of alcohol commonly known as ethanol or grain alcohol, isopropyl alcohol, an alcohol that is sometimes referred to as rubbing alcohol, and methyl alcohol, an alcohol that is sometimes called methanol or wood alcohol. Methyl alcohol is considered to be too weak to be used as a disinfectant. Hence, we stick to using the former two instead. The way that these two alcohols destroy bacteria, viruses, and fungi is through something known as protein denaturation. In basic terms, it's a process whereupon a protein loses its higher order structure. And don't forget that the ideal concentration of alcohol for microbicidal activity is between 60 and 90%.